First of all, just wanted to say a big welcome to everyone that's come along today. Thank you so much for taking time out of your day to join us. I'm so impressed with the popularity of this launch event. We had well over 100 registrations, which is phenomenal and absolute testament to how important healthy eating in early childhood services is to us all. So really great for you to join us. First of all, I'd introduce myself. I'm Michelle Gilmore, Senior Project Officer at the Healthy Eating Advisory Service and the Project Manager for the Healthier Food Environments for Long Daycare project and Cooks Connect. Anna Broughton is also joining me today from HEAS, our Nutrition Policy Advisor for early childhood services and schools. And we're both so excited to launch Cooks Connect today, part of a new Healthy Eating Advisory Service initiative designed to empower health promotion officers in establishing and running their own local cooks network to support their work with long daycare services. I'll just go through a bit of housekeeping first of all. Please pop your questions in the chat as they come to you, and we will allocate plenty of time at the end to go through them and endeavour to answer all of them. And also, please pop yourself on mute while we go through the webinar so that we can get going without distraction. And thank you all again, and let's get started. So first, we would like to start by acknowledging the traditional custodians of the land on which we are meeting today. And for the HEAS team, it's the Wurundjeri people of the Kulin Nation. I pay my respects to their elders, past and present, and to any Aboriginal and Torres Strait Islanders people here today. I'd like to give you a quick outline of today's agenda. First, we'll provide some background about the origins of the Cooks Connect initiative, and we'll then have Kayla DeMeo, health promoter at Better Health Network, presenting on her experiences running a Cooks Network. And then we'll provide a sneak peek of Cooks Connect, including a showcase of our new webpage for health promoters. We'll then have Irene Dunphy, a health promoter from Link Health and Community, present on her experiences establishing a brand new Cooks Network. And we'll finish with some next steps and time for any questions from myself, Anna, Kayla, or Irene. So for those of you who are not already well aware, the Healthy Eating Advisory Service is delivered by Nutrition Australia Victoria Division with support from the Victorian Government. And we support long daycare services and the health promotion workforce in Victoria to provide and promote healthier food and drinks, meet the Victorian Government's menu planning guidelines for long daycare, and meet Element 2.1.3, healthy eating and physical activity are promoted and appropriate for each child as part of the National Quality Standard. And in 2022, we had the wonderful opportunity with the support of the Victorian Government to identify ways in which we could strengthen the capacity of long daycare services to create healthier food environments. The first step, which involved many of you here today, was to conduct a statewide multi-level needs analysis of the long daycare sector, focused on reaching a diverse representation of key stakeholders. The aim of the needs analysis was to identify any opportunities to better support long daycare services and strengthen their capacity to provide and promote healthier foods and drinks and meet the Victorian Government menu planning guidelines for long daycare. A total of 55 stakeholder interviews were conducted, including representatives from our partner programs, researchers from a range of universities, and a diverse cross-section of health promoters, cooks, educators, and centre directors from a wide range of organisation types. This data was supported by literature reviews to compare our findings with current research and best practices. A huge thank you to the health promotion officers that have provided their generous and valuable insights in support of this project so far. From this needs analysis, a number of key findings were identified, including that cooks often have inadequate time, budget, training, and capacity to perform their role, particularly when it comes to meeting nutrition needs. Cooks typically work in a peerless environment as the only cook among a team of educators, yet they thrive on peer-based learning and connection. Cooks really need increased opportunities for professional development and really appreciate acknowledgement for their efforts. Cooks really need engaging, practical training and resources in plain language, including real-life examples. We also found gaps in knowledge and confidence around allergies, intolerances, and dietary preferences, meeting nutrition requirements within budget constraints, and supportive breastfeeding practices. And we also found an opportunity to make some enhancements to Food Checker for menu assessments. We found that long daycare services themselves could benefit from greater integration of cooks in the day-to-day practices of the organisation, increased incentivisation to prioritise healthy eating, and greater visibility of government and Nutrition Australia branding in support of healthy eating implementation. And last but not least, health promoters across Victoria told us that they need tailored capacity building support and resources to help them understand and implement the menu planning guidelines, use Food Checker to assess menus, and engage long daycare services in healthy eating practices. Health promoters also highlighted the need for co-branded training and resources to boost the credibility of their engagement activities with long daycare services. We learned that Cooks networks were being used as a strategy to support healthy eating implementation. And finally, that opportunities existed for strengthened program alignment between HEAS and our partner programs, Smiles for Miles and the Achievement Program. So we came across so many great opportunities for the strengthening the work that we do in supporting healthy eating in long daycare. But one of the standout strategies highlighted by health promoters was how efficient and effective Cooks networks could be at supporting many of the identified needs concurrently. It also became clear what role HEAS could and should play in supporting Cooks networks across Victoria. So I'd now like to invite Anna Broughton to tell you more about what a Cooks network is and how a Cooks network can be used as an effective strategy to support long daycare with healthy eating. Thanks, Anna.
Thanks, Michelle. So what exactly is a Cooks network? So a Cooks network is a collaborative community of cooks that meet regularly to share knowledge, to network and develop their skills. The Cooks network is typically facilitated by health promotion officers who can bring together cooks in their local area. And the purpose of a Cooks network is to provide a supportive environment to build the confidence and capacity of cooks working in long daycare services, to plan menus that meet the menu planning guidelines for long daycare using a whole of service approach, and to overcome common menu planning or food environment related challenges such as allergies or fussy eating. So why are cooks so important? So a long daycare cook carries the responsibility of providing nutritious foods for children through some really key developmental stages in growth, learning, health and well-being. And on average, a child attending long daycare spends 31 hours or about 4 days a week in care and consumes about 50 to 70% of their daily food intake whilst they are in care. So cooks are responsible for really quite a significant portion of children's nutrition and food intake. And within menu planning, food preparation and managing a kitchen, there are so many elements for cooks to be on top of, such as obviously nutrition and the menu planning guidelines, but also budget, food safety, dietary requirements such as allergies and intolerances and food waste, just to name a few key areas. So cooks really deserve to be supported, to have access to training and professional development, and to be acknowledged for the work that they do, which is very valuable. So what are the benefits of Cooks Network? So there are many benefits for all stakeholders. Some of these key benefits to cooks specifically and their long daycare services include having access to peer support and networking, to have that opportunity to share knowledge and experiences with other cooks and to problem solve common challenges together. Also an opportunity for relevant professional development and training to increase their knowledge and skills in providing healthy menus that meet the menu planning guidelines and to overcome common challenges. It's an opportunity to provide acknowledgement for the work they do, and it can help build the cook's confidence and capacity to advocate for better nutrition and also advocate for themselves and their work needs. Cooks networks can also support the Long Daycare Centre with their quality improvement plan and reporting under the National Quality Standard. And it also empowers long daycares to promote and showcase a healthy menu to prospective families. So for health promoters, there are also many benefits of Cook's networks, such as greater reach, engagement, and efficiency in supporting long day care services in your area. And by bringing Cooks together, you can save time by supporting multiple long day care services at once. Cooks networks also align with the community health promotion guidelines and can help you with your reporting requirements by providing data collection opportunities. And it can help you encourage the uptake and implementation of evidence-based programs and initiatives to support healthier food environments. So as we've touched on, the Achievement Program and Smiles for Miles. And through running a Cooks network, you can also have access to HESA's resource and guidance to support you in setting up and running the Cooks network, and also HESA's professional development materials to educate cooks on relevant topics, which we will touch on later in the webinar. But for now, I'd like to invite Kayla DeMayo to speak. So Kayla is a health promotion officer at Better Health Network, supporting early childhood services in the city of Kingston. Kayla has been running a Cooks network in collaboration with Caulfield Community Health for over 2 years now, and she's going to share her very valuable experiences and insights and outcomes of her Cooks network with you all. Thank you, Kayla.
Thanks, Anna and Michelle. So hello, everyone. As Anna said, my name is Kayla and I am a Health Promotion Officer at Better Health Network. And I'm really pleased to be here today to talk about our Cooks network that I do deliver in partnership with Caulfield Community Health Service. So we've been delivering our Cooks network to cooks in the Glen Eira, Kingston and Stonnington catchment areas for the past 2 years. We're just about to enter into our 3rd year of the network. So why did we start a network? Through conversations with cooks and observations, we identified that there was a lack of opportunity and support for this workforce who plays such a pivotal role in the provision of food and drinks to the children in their care. There were no opportunities for them to attend professional development or receive support outside of their centres, and so we developed our Cooks network. The aim of our network is to increase the capacity and skills of long day care cooks in the provision of nutritious food and drinks in alignment to the Victorian menu planning guidelines for long day care. We also wanted to provide cooks with an opportunity to connect, share and learn from one another. This workforce is quite isolated and not provided with many opportunities to interact and engage with other cooks. We wanted to provide them with a space where they could feel safe and open to share ideas, tips and tricks, as well as their concerns and troubleshoot any issues. So advantages of a network. So the advantage for us and our roles as HPOs of a network is that we can reach a larger number of cooks and long day cares. So in the first year of our network, we had 30 cooks from 28 different long day care centres attend at least one session. For 18 of those centres, it was the very first point of engagement that we had actually had with them or their service. 20 cooks attended 2 or more sessions, and we had on average 12 cooks attend each session. Across the first year, of the 28 participating long day cares, we approximately reached 2,805 children through the cooks' involvement within our network. Without the network, I really truly believe that I would only been able to engage 2 or 3 long day cares over that time period. It also provides collective insights and the opportunity to identify themes across the workforce. Through the rich discussions and insights shared by the cooks, we are able to gain an understanding of common issues, gaps in support or resources, identify where our efforts should be targeted and where there may be opportunities to bring in experts, for example, a paediatric dietitian to discuss fussy eating. These insights and themes help us to target the support and content that we deliver in the sessions, as well as the development of resources. I've also been able to use these insights and themes to engage with cooks who don't attend the network. Cooks are able to network and provide better peer support to one another, helping to troubleshoot and engage in learning exchange to deepen their knowledge or improve their practices. This is extremely valuable as the cooks all have first-hand experience and knowledge of what it's like to work in a long day care kitchen. You know, sometimes the suggestions or ideas that we can provide may not always be as practical or realistic, despite our very best efforts. So to have tried and tested suggestions or ideas is highly valuable. Next slide, please, Michelle. So looking at outcomes. So the main outcomes of the network for us include menu alignment to the menu planning guidelines, increased engagement with long day cares and networking opportunities for the cooks. So in the first year of the network, 10 two-week menus were adapted to meet the guidelines. This occurred through capacity building at the sessions, but also continued support from the HPOs for the cooks between the sessions. As mentioned on my previous slide, there has been increased engagement with long day cares. Not only has there been increased engagement with the long day cares in menu assessments and support in the food space, but also with additional frameworks such as the Achievement Program, as well as specific organisation resources or support. Another main outcome is the networking opportunities, and I do feel like I'm repeating myself, but it's just such a vital part of the Cooks Network. We conducted a Mentimeter asking the cooks what their favourite thing about the Cooks Network was, and the most common response was sharing of ideas and meeting other cooks, which demonstrates to us the value placed on the networking component. The discussions and networking component of the session is always my favourite part, and it's so insightful. Shared resourcing, so through the joint partnership with Caulfield and BHN, that has enabled the network to be what it is today. It's been an enjoyable partnership, and it's enabled us to reach more long day cares than we would otherwise have been able to reach if I was delivering the network on my own. Through our partnership, we are able to pool physical resources which support the delivery of the network. This includes things like venues, devices, resources. We are also able to share and benefit from the involvement of other organisation staff. So, for example, Caulfield's paediatric dietitian presented at one of our sessions on fussy eating. The BHNP dietitian had absolutely no capacity to provide any sort of professional development for the Kingston cooks, but by being part of a network, the Kingston cooks who attended were able to benefit from that capacity building from the paediatric dietitian at Caulfield. Through having a network of HPOs with different skills, knowledge and expertise, as well as diverse perspectives, we are also able to learn off one another and engage in our own capacity building and personal professional development. And we're also able to share the workload, meaning that we can achieve more and are able to rotate different tasks based on capacity, skills or interest. Next slide. So my top tips for HPOs who are thinking about starting a network are to know and understand your target audience, be adaptive, let the cooks lead, and keep your perspective. So knowing and understanding your target audience is so vital. The cook's workforce is very unique, and for each cook, the circumstances and environment at their centre is also very unique. The way that you support educators and centre directors will not work for cooks. The first few sessions of your network will feel very much like trial and error, but from experience, this has been the best way to really identify what will work best for the cooks in your network and how you can best support them. For example, we have found that cooks in our network are not very tech savvy and prefer to complete evaluations via paper rather than online. And by making this swap, we now have a 100% completion rate of our evaluation surveys. Be adaptive and let the cooks lead. Very early on, I realised that the cooks love to talk. They love sharing their experiences and providing support to one another. For each session, we have an agenda which outlines what we will cover. But more often than not, we veer off track as the conversations and insights lead us into a different direction. And these discussions and insights are often more valuable than what we could contribute. And so letting them lead and us pivoting is vital to success and continued input from the cooks. And keep your perspective. So it's really important to keep your perspective, as there's a lot of time and energy put into preparation for the sessions, making sure that it's going to run accordingly and that it's going to be worthwhile for the cooks. There's been many times where we've had a small number of cooks attend despite, really large RSVP numbers. And it's just really important to remember that each cook actually represents a large number of children. While we might only be engaging that one cook or two cooks, the information, skills and capacity building that we are providing is actually supporting X amount of children and in turn X amount of families as well. So that's all for me today. I hope I provided some useful insights into what a Cooks Network is all about and how it can benefit your work in the early years space. If you have any questions, please don't hesitate to reach out. I will pop my contact details in the chat. Thank you.
Thanks so much, Kayla. Definitely some very valuable insights there and a really great example of the power of Cooks Networks as well. So with help of expert health promoters like Kayla, we were able to gather together all the insights and expertise from across Victoria, and using a co-design approach, we developed Cooks Connect. So Cooks Connect is an all-inclusive suite of co-designed training, support and resources to empower you, the health promotion workforce, to establish and manage your own local Cooks networks. So we really can't thank our co-design working group enough for their generosity and contribution to this offering. This suite of resources have been tried and tested by so many of you that we're confident that it's everything you'll need to succeed. And we've called it Cooks Connect because that's exactly what it enables cooks to be able to connect. And it provides you, the health promoter, with the step-by-step guidance and resources to bring cooks together in your area and efficiently build their confidence and capacity to provide healthy food and drinks in their long day care services. So what we're showing you today as part of the launch of Cooks Connect is just the tip of the iceberg. We do plan to have much more to come throughout the rest of 2024. But first, we will showcase the Cooks Connect toolkit. So the toolkit started out as a student project with 2 dietitian students that we had at HEAS. So big thanks to Hannah Bussell and Taylor Leeson for their work on this. And the Cooks Connect toolkit has now grown into an invaluable collation of gold standard guidance based on the expert insights that we received from health promoters around Victoria who have successfully built their own network. And this 25-page comprehensive toolkit involves all the step-by-step information and accompanying resources you need to plan, promote, implement, evaluate, and maintain a Cooks network, with some examples there on the slide. So inside the toolkit, you will find success stories from other health promoters, tips on how to launch your brand new network. We've also included a pros and cons list of hosting a network online versus in person, or a hybrid of both these ways of facilitating a network. We also have a list of the most popular professional development topics that we were able to find from also involving some cooks in this process as well. Some examples of icebreaker activities to build a connection between new members. And also advice on how to maintain momentum and engagement in your network. Just to name a few things, there's much more within that toolkit as well. So we made sure also to road test it with our health promoters and received some really fantastic reviews, such as some of the ones on the slide here. And this Cooks Connect toolkit is the place to get started if you're thinking about establishing your own network. And then alongside the guidance contained in the toolkit, we've also developed a suite of supporting resources to make it easier for you to succeed in establishing and running your network. As we know that many of you have limited time to develop the resources to host your own event. So we've done all the hard work for you in getting some of these templates as part of the pack. So the Cooks Connect suite of resources, you'll also find a supporter kit. And this supporter kit is designed to boost your engagement with long day care services and assist you to promote your own new local network with the added credibility of HEAS, Nutrition Australia and Victorian government branding. So as part of this supporter kit, we've developed an editable invitation template to send out. You can use it electronically or in print to your local long day care services to invite them to join your network. There is also a collection of social media tiles and copy for you to use on your own social media platforms to promote the network, and also some key handy messages that are targeted at both cooks and centre managers as well. So another resource as part of the Cooks Connect package, we've also developed an editable certificate of attendance for the network sessions. So we know that some cooks have difficulty getting support from their management to attend a Cooks network. And our co-design process identified some really clever strategies that health promoters use to increase support for cooks, and providing a certificate of attendance that outlines the topics that were discussed and the training that was provided in each session can really help to support cooks to advocate for paid time to attend the network sessions. And this template we've also made so you can personalise each certificate with editable fields and add the name of your Cooks network and your organisation logo as well. And cooks will also hopefully benefit from the added credibility of the HEAS, Nutrition Australia and Victoria government branding as well, which you can see on the bottom of that certificate template there. And then another way we've tried to reduce the health promoter's workload is to develop a selection of survey templates. So it's really important to be able to regularly ensure that the network is meeting the local cooks' needs. and also equally important to demonstrate the effectiveness of your network at meeting your health promotion goals over the longer term. So we've developed a participation survey to assist health promoters in the early stages of starting a network to help collect information about the wants and the needs of the local cooks in your area. We've developed a satisfaction survey to help you measure cook satisfaction of the Cooks Network session and also to identify possible areas for improvement. We've developed a professional development survey to evaluate the effectiveness of professional development sessions. And finally, we also have an evaluation tool to assist you with your reporting requirements. So this can help you evaluate the overall impact of your Cooks Network. And you're probably wondering where to get all these resources from. So we'd now love to show you a sneak peek of the brand new home for health promoters supporting long day care with healthy eating on the HEAS website. We've developed an exclusive section just for you, which we will show now. So where you can find this on the HEAS homepage, if you click I'm working in and then early childhood services, and then you'll now see a new health promoter resource section in the drop-down menu. So when you click this, you'll come to the health promoter resource page, as we've explained. This is just the beginning for health promoters supporting long day care. So over the coming months, this content page will continue to grow. But today, we want to show you where to find Cooks Connect. So this content block here will take you to all the resources that we've showcased in the presentation today. So you can see the Cooks Connect toolkit and all the supporting resources are ready to go. So we really encourage you to jump online after today's session and have a good look around and through the resources that are available as well. And soon we'll also be adding a directory of all the active Cooks networks across Victoria to our website to make it easier for cooks to identify a network in their area and join a network in their area. So make sure you let us know about your Cooks network or if you're starting one so we can add it to this directory that'll be coming as well. And now I'll hand back to Michelle.
If I'm not on mute. Thanks so much, Anna. Yeah, as we said earlier, today is just the beginning of Cooks Connect and our support for the health promoters in long day care. There's so much more to come. But I would like to show you now some of what's coming up next. So coming soon is a suite of professional development resources and packages for you. And we know that many health promoters supporting long day care or healthy eating in general don't have access to a community dietitian, or they're really busy, as Kayla said earlier, and they don't necessarily have the capacity to develop and deliver professional development or training themselves within a Cooks Network session. So our needs analysis identified an opportunity for HEAS's expert dietitians to develop a consistent, centralised source of professional development materials on the most popular topics that cooks identified wanting further training and support in. So each professional development package that we will provide to you will include a lesson plan to help you prepare for and structure your sessions. It'll also include instructional videos, so you just need to press play and let HEAS deliver the content. It will include activity and answer sheets to assist cooks to apply their knowledge in a practical way, and guided Q&A content to support health promoters to facilitate knowledge sharing and discussion. And to finish it off, a certificate of completion for each cook to proudly display in their centre. So as a health promoter, all you need to do is facilitate the delivery of this session. And to help you guys get up and running, we'll even be running a Train the Trainer session on each professional development topic to teach you how to facilitate the session. So what are the professional development topics coming soon? Let me tell you. We'll be launching Session 1, Understanding the Menu Planning Guidelines for Long Day Care, in late March or early April. So stay tuned for an invitation to the first Train the Trainer session. And later in the year, we'll launch Session 2, How to Use Food Checker for Long Day Care. And that will be followed by Session 3, Managing Fussy Eating. So we know they're the top 3 topics that most cooks are interested in hearing about, and we look forward to being able to help you deliver those professional development sessions to the cooks in your network. And now I'm going to hand over to Irene. Irene is a health promotion officer at Link Health and Community in Glen Waverley, and she's recently established a new cooks network for the city of Monash. She's going to share her experiences today in getting a brand new cooks network up and running. Thanks, Irene. Over to you.
Thanks, Michelle. It's lovely to be here, and good morning, everyone. So I'm a health promotion officer at Link Health and Community, and I started with Link back in August of 2022. And my role was to support early learning centres in the city of Monash. I'm a 0.8 role, and there's only me. I don't have any other health promotion colleagues working in that area in this local government area. So I was wondering how I would support them, given how little time I had. And if we go to the next slide, I could show you just how many services we have in Monash. So here's the context. So there was over 90 early learning centres in the city of Monash. And I was a 0.8 role and supporting them, and particularly supporting them with healthy eating and active play, like we all have to do now under the health promotion guidelines from the Department of Health. So how I would go about it. And I made the decision to do a needs assessment. So develop a questionnaire and go out and try and visit services and learn from them what was important for them, what their priorities were, what their knowledge was of the menu planning guidelines and healthy eating, and how they would like to be supported. And the decision to try and network them, the decision to try and bring them together so I could support them collectively, given I'm a limited resource, versus doing individual visits all the time, and asking them if they'd be open to that networking support. So I visited 22 during that time, between August 22 and about the same time in 2023. And a common theme coming out of it was support for cooks, support with the menu planning guidelines. And if we go to the next slide. So this was building relationships then. After I gathered that information, I developed a quarterly newsletter. I wanted to send this newsletter out to all the services in Monash, letting them know that I was here and the support that I could offer. Knowing that I could link services to resources if I couldn't support them individually, there was going to be support for everybody, and it would be dependent on how I could do it, in person, giving them resources or inviting them to networks. I also sent a once per term email with the offerings for that term. Anything that I had or wanted to promote during that term, I could offer to everybody. Around the same time, a local day service in Monash had contacted Healthy Eating Advisory Service to provide a PD for cooks in their area. And Anna, I was in conversations with Anna during this time about the establishment of the Cooks Network in Monash, and learned of this one that was happening, so I could attend it and promote my network that I was going to establish for them. When I attended that session, one of the person who organized it came up to me and said, "Oh my God, Irene, if we had known you were organizing something, we would have waited for yours." But I couldn't let them know at that point because I hadn't yet, made a date, found a venue. But I said, it's coming. This is coming, and I'm going to be launching in November, and I will give you all the details, and everyone will get an invite. And they were so excited. They were so excited to know that this is going to be an ongoing network. It wouldn't be just a one-off PD. So planning commenced for that first network session in November of 2023. Managing fussy eating was the number one concern of every centre I consulted with. It was something they were all dealing with. And I felt if we were going to launch, I wanted to launch with that because I felt more services would attend and I would get better engagement in order to keep that engagement ongoing. If we go to the next slide now. There's one more slide.
Is it not coming? Oh, hang on. This one?
Yes, that's right. So this is our first session. We had 9 services attending and 14 people. Now, it's really important that you know, too, that when I sent the invite out, I sent the invite out to the center manager because that was the contact that I had. And I asked them to provide me with the name of their cook or to invite their cook to this network. And what actually transpired then at the network and with the RSVPs I was getting was that not only did educators want to attend with the cook, but the center directors, some of them wanted to attend with their cook as well. And I think it was because it was the topic of managing fussy eating, because the educators were facing this in their role of, helping the children consume the food and encouraging them. And the cook was the one cooking it, and the center director was in charge of the whole thing. So they could really see their role, and they were all interested in this. The venue was amazing. So when I looked for venues, because we didn't have one at our workplace, so I had to look out into the community. And I went to a community house, and it was the ideal location for a network because not only did it have all the ITC, it had a beautiful room, it had a fantastic kitchen, and they even had a garden surrounding the community house, a produce garden. And I thought that was wonderful too, to show cooks and educators, center directors and educators, how little space you could grow food in, and to encourage them to grow food at their service and, have a couple of raised beds and be inspired by that. Not alone was it that great venue with all of that resources available, but it was also only $15 to rent it per session. So it was incredibly cost effective for me when I had very little budget. So that session we ran in November only cost $45 with the afternoon tea provided and with the room hire. And if we go to the next slide. And this is some of the feedback from the session. Overwhelmingly, they were thanking me for bringing them together. They said, we cannot believe that this is going to be ongoing in Monash. We've never had this before. And I felt so great in being able to really give them something they were going to value. Wonderful things happened at that network. The networking and the conversations between them were amazing. And for them, one of the activities they had was to share tips on how they're managing fussy eating at their service. And the knowledge they had and the ways they went about it at their services, to hear how they all tackled that. And when we asked them what was the biggest learning in the evaluation form, when we asked them what was the thing that you learned today that you will implement, it was an idea that had come from one of the services, not from the presentation by Anna on managing fussy eating. It was something they'd learned from the services that they were going to implement. When I asked them, what was the best part of the network? Was it the information provided? Was it the networking with each other? Overwhelmingly, it was networking with each other. So it really brought the network to life and telling them that, this is your network and this is my message to them. This is going to be ongoing. I'm going to help facilitate it for you, provide the venue, provide some content, but ongoing, you're going to own this network because you have the knowledge and you can share the knowledge with each other. And that's what I want it to be. I want it to be long after I'm gone, that this network will keep going, that they'll keep it going. And if we just go to the next slide. So the network will be ongoing, like I was saying. The next one, once per term, the next session is on March 20th, and that's going to be on meeting the menu planning guidelines. And the reason it's going to be that topic is because that was all of the services put that as their #1 topic for the next session, which was fantastic news for me, because in terms of my reporting for health promotion, I'm supporting 9 services to meet the menu planning guidelines rather than doing individual visits out to services. They reported that the venue and the time allocated in the afternoon was ideal for all of them, because I offered them hybrid, in person, and, different options, and they all said in person, same location, same time, which made my job so easy in organizing it. We offered them topics, like I said, and they chose menu planning guidelines. And so I sent an email out at the start of term with the invite and the date. Again, I sent it to all the services, not just the ones who attended the last network. And I've had 9 responses so far, so 9 services. And again, I've got centre directors and cooks, or educators and cooks coming along. So I think it's really great that it's a whole of service approach almost that they're taking, because all of them are getting the information. And that's it for me. And I'll put my details in the chat if anyone wants to ask any questions or, wants more information ongoing.
Thanks so much, Irene. Absolutely impressive work, and yeah, so inspiring to see how you've started from scratch and built the momentum and got such a great attendance at your first and looking like your second network event. So well done. And can I just say that all of your experiences you shared, and Kayla as well, I had the privilege of talking to as many health promoters as I could find across Victoria running Cooks networks, and it's a really common story that cooks really thrive on the opportunity to network with their peers and come together and just share their ideas and knowledge, and it's so powerful. So thank you for doing such great work, Irene, and thanks for sharing that with us today. Now I'm just going to look at where to from here. So I really appreciate you all turning up today. And first of all, at the end of our session today, I'd really love you to jump online and visit our Health Promoter Resources webpage. We'd love you to check that out and take advantage of the resources that we've developed for you. And then download that Cooks Connect toolkit to get started in thinking about and planning a network for yourselves. And then we really want to hear about it. So tell us about the network that you've got planned, and also tell us about a network if you've already got one up and running and we don't yet know about it. We would love to help you promote it. We're also building a section on our website where we will list all the networks across Victoria to help you promote your network and help cooks to be able to find one as well. So do tell us about it. And obviously we're here to help. So please get in touch and let us know what you're up to and how we might be able to help you. And finally, just keep an eye out and an ear out for our first Train the Trainer session. So we will be teaching health promoters how to facilitate session 1 of our professional development sessions, that understanding the menu planning guidelines for long day care. And following this webinar today, we'll send out an invitation to all of you in the coming weeks. So thank you so much for all your attending today, and I really appreciate you prioritising this event. We hope you're feeling just as excited as we are about Cooks Connect. And I'd really like to extend a big thank you to Kayla and Irene for sharing their experiences with us today. We hope you've all been inspired by their achievements. And now we have plenty of time for questions for myself, Anna, Kayla or Irene. If you can pop them in the chat, and if we don't manage to respond to everything today, we will endeavour to provide you with a response in a follow-up EDM, and we'll include a link to this webinar as a recording as well for you to watch it back. So thank you again, and I'm going to open it up to questions.